Welcome back to the second part. We're back with Makayla. We didn't go anywhere. I wanted to ask you a little bit about your research journey since you graduated as an honors student in nursing.
Yeah, so I'm also part of the nursing honors program, and so I when I graduate or when I did the pinning ceremony on Wednesday, I realized that I was one of three Indigenous students in the honors program, and I was surprised that there's not that many, and I'm very grateful to be part of the program. And so I actually want to tell everyone like my journey, even going into the honors program, it just feels like a true miracle, like a dream come true. And so this was at the end of just about the end of my second year of nursing. And I was talking to one of my teachers, and they actually said, Michaela, hey, have you thought about the honors program? And I said, right away, I was like, no, because I thought to myself, I thought, I'm not smart enough for the honors program. I wouldn't even consider it. And so I reached out to or they reached out to me to have like a meeting. And I think this was in May. And so the faculty of nursing, they actually asked me to join the honors program. And for example, the deadline passed. It was already like end of March. I missed the application deadline. I didn't apply for it. And I didn't have the 3.3 required GPA to get into the honors program. And I thought I had maybe a 2.6 or something lower, but I was at a 2.9. And so the university said, you're close enough to a 3.0, we want you to join. And I was so like surprised because research is not something I thought I would ever do or would ever want to get into. And so I remember I had time to think about it because I was already enrolled in the nursing fast track program. So I was debating doing the fast track program or the honors program, and then that would delay my graduation time. And so I remember one night I was thinking about this decision. I was thinking about it and I started crying because I thought about saying no to the honors program. And the reason I was crying, I thought, if you asked me 5 years ago, I never would have dreamed that I would have the option of saying no. And I realized that regardless if I feel I'm not smart enough because I'm Indigenous to join the honors program, I need to. So I said yes, I joined, and I realized that I did it not just for myself, I did it to help inspire that next generation of Indigenous students to realize that they can join the honors program and they can do research to help Indigenous people in their communities. And so I'm so grateful for being in the honors program. And if I do come back for more education and more research, something I would want to do is learn about why Indigenous communities still don't have clean drinking water. And so that's a personal interest. But when I did the honors program, so part of my research over that summer, over that year, it was looking at HPV vaccinations for Indigenous youth in Musqueam. It's an Indigenous community not too far away from Edmonton. And so it was really valuable learning that research experience, what research does and how it can help a lot of people and create change in hospitals. And just seeing how you can interact with Indigenous communities in research, because I learned that when you think about Indigenous people in research, there's a lot of discrimination, a lot of mistrust. And for example, something I learned in my education is that Indigenous patients were used for skin grafting experiments without consent. And there's a lot of stories like that. So it's interesting to learn about it and to help inspire that next generation to realize that Indigenous people can become part of the research world and make change that way.
You shared a very interesting historical context to like the history of Indigenous people in research in Canada. Do you like in what ways do you think that still manifests into research today, or do you think it still manifests into research today?
I think one important thing when you think about research and Indigenous people or in Indigenous communities, what I've learned and realized is that sometimes research companies or they it's more important for them to work with Indigenous communities to get ethics approval, and not because they care and want to work together with Indigenous communities. That's the biggest thing that I learned, and how you can really make a positive relationship is not working for or working for Indigenous people or communities, it's working with them in partnership, in collaboration, and asking them for consent and going through all these ways to work with Indigenous people. That's the biggest thing that I've learned and the biggest way we can make change.
That is a very insightful way to think about it. I actually have not thought about that before. And how can researchers in the health discipline specifically be allies to the Indigenous communities in their research?
For one example, for example, if you're doing research with Indigenous people, with the community, is offering a protocol. For example, getting an advisory committee involved and working with different elders to have them incorporate like their own knowledge, their own cultural and history with the research process. And then through that way, they can be in collaboration and partnership. And then it makes the whole research process seem more meaningful, not just to the research itself, but to the Indigenous people and community that it's trying to help serve.
That's actually pretty important to take into consideration. But when you mentioned that, I just being a little bit knowledgeable about like the methodologies and how research funding works, I could see some barriers that exist in the system, such as like very strict timelines, having very strict timelines where everything has to be done by, or like even the research methodologies of like using quantitative data, which is a bit different than like Indigenous ways of knowing, as far as I know. How do you see these barriers and like affect the relationship that researchers can have with Indigenous communities?
I think that's a great point because when I was thinking of a story and one of the articles I was reading or one of the research papers is like an Indigenous elder brought up that same question you brought up where researchers are so, it's more important for researchers to think about that timeline and deadlines than actually working with Indigenous people and asking them about what they think or what they have to offer. So I think that's a barrier in itself. And I think the only way to kind of overcome that is through that collaboration process and having that good interaction, that meeting, and actually wanting to create positive change for the people in the community. And through that, I think timelines can be worked together.
Yeah. And for, you mentioned protocols as well and like the importance of using protocols. Do you think it's, like if someone doesn't know a lot about like Indigenous protocols, what do you think is an appropriate way to go? Like, do you think it's more appropriate to ask them directly or like do some research or ask other like like community members? Like, what do you think is an appropriate way to go?
I think for we can always do our research, right? We can always look up like in the area what's most appropriate, but also if you're in that situation where you've never done this before, I think it's amazing the fact that you're even thinking about the protocol or offering tobacco. The fact that you're thinking about it is you're already being part of that change. And so my advice is just to ask, okay, I've never done this. I want to be respectful. How can I do this? Because I remember, for example, I attended a conference in 2024 and tobacco was offered to an Indigenous elder and the elder received it. But when she got up to speak, she said, "Thank you for the tobacco, but this is the wrong way to do it. It should have been done this way." And I think the biggest issue was there was no communication with how they want to receive it, what's the correct way. So if you're ever unsure, of course, always ask and just remind them or yourself that, this is my first time, but I want to learn. And that's the biggest thing.
Yeah, that's a great takeaway. Yeah, and then we talked about like a lot of the barriers, but then what are some of the really awesome things that are, if you want to share like awesome things that are happening in research right now with Indigenous researchers or with a Indigenous community that you think are pretty?
I think for when you think about Indigenous research, I think it's amazing that there are more Indigenous people entering the research field to think about how to make change in those Indigenous communities. And so I think for everyone listening, especially Indigenous students, if you thought about research, and encourage you to join the honors program so you could see what research really does and how it could expand to an international issue for not just global health, but thinking about the health for Indigenous Canadians. And I think a message of hope to anyone who's even thinking about the honors program is I didn't feel smart enough. And I remember for one of my honors research papers, I think I cried after I wrote it because I didn't think I was smart enough. I didn't think I was a good writer. And towards the end of my honors education, I did really well in my writing because I realized that I'm Indigenous, I'm smart, I can do the honors program. And so for anyone thinking that they're not smart enough, I encourage you to join. It's a great learning opportunity, and there's a lack of not just Indigenous researchers, but researchers in general. So I think this would be a great message of hope for anyone. And also to mention a quick little fun story. So remember my nursing pinning ceremony?
Yes.
Yeah, just on Wednesday. So when I showed up, I'm part of the honors program, and I did not realize that there's 3 different pins, and they're color coded. And so I thought this is so funny. I think it's like the nursing Olympics, right? Because you think of the Olympics, there's bronze, silver, and gold. So I have the gold. Yeah. So bronze is the nursing collaborative program. Silver is the bilingual program, and gold is actually the nursing honors program. Nice. So if that's like another motivation for anyone listening, I think that's really funny. The nursing Olympics. So come join me in the top place in the honors program.
Yeah, and I see you're wearing it today, which is so nice. Is it actually made of gold?
I hope so. After all this years.
Yeah. That's something to look forward to, I guess. Yeah. Is there any other stories you want to share from your honors journey and your like nursing research journey? Or
I think in my honors program in the summer, I actually got to travel to Musqueam. It's that Indigenous community just outside of Edmonton, and it just reminds me of where like my back home was, right? Just because the roads are not paved. There's the issue with cell reception, but also when I did more research into Musqueam, that community, and seeing the systemic barriers that affected like the homes, but also the violence that occurs in those Indigenous communities, and the amount of death that does happen in Indigenous communities. And it's hard to read about, but it is true. And when you think about the violence that happens there in the research, I see why the research is there to benefit the community and trying to make change and change the health for Indigenous people in that community as well.
Yeah. Cool. Was that for, like, did you travel there for your...
Yeah, for the honors research, just to kind of, I think that's an important part about research too. It's not just reading about the community, but actually going to visit and kind of see where the research is being done and who the research is supporting.
Mm-hmm. Mm-hmm. Yeah, totally. Your honors journey is pretty wild. It's pretty inspiring, and it's pretty unique, very, very unique of what led you to be here. I guess I have 2 more things that I kind of wanted to ask. So, are there any like resources that you think students can learn from that are like done by Indigenous researchers or Indigenous elders in terms of like how to in terms of like being better I don't want to say the word advocates, being better allies to the Indigenous communities in health care and also research that you want to share if they're interested in learning more?
Oh yes, I think without the honors program, I wouldn't have learned about Indigenous research. And what I realized doing research is it's a lot of reading. It's a lot of reading about articles, but it will benefit your own knowledge if you're curious. And I think, for example, like when I go on the U of A library website, something I would want to look into is looking at just searching how research can be done with Indigenous communities. And so that's the best way I expanded my knowledge, because I'm going to be honest, I wasn't planning on going to research. I had no idea what the research world was. And I think the reason why I was hesitant is because it wasn't just that I was Indigenous and I felt not smart enough for nursing, but I thought research is like learning a new language. And so for me, I came from a background where I didn't have a strong foundation. And so I was really hesitant. But the more I learned, the more I realized the different barriers that are in place in research for Indigenous people. And that just made me want to learn more. So I'm still in that process of learning, and I look forward to expanding my knowledge and, yeah, just wanting to help treat Indigenous people better in all scenarios.
Any particular articles or like documentaries or movies or books that you came across that you think are that you recommend?
I would have to double check the article author, but for example, I think if you type into the U of A library, it's walking in a good way. And it's kind of thinking about intersectionality and just thinking how can you actually work in partnership with Indigenous communities, and that's the biggest thing. And I think not just with research, but in healthcare, that's like the biggest thing is the collaboration it's working with, because when you think about Indigenous people and how they were treated in healthcare and all systems, it's everything was done to Indigenous people and not with them. And consent was never asked in all situations. So I'm thinking just keeping that background in mind, and that will bring you very far in your journey and your future career.
I'll check that out. And then I'm so curious, what are you up to next? You're doing a lot of great work now. You've been doing a lot of great work while you were in nursing school. You're also the CNSA Indigenous Student Advocate.
Oh, I
What was
see.
the position?
So I think I guess I'll start back in, yeah. So it was January 2024. I went to the Canadian Nursing Student Association, and that's where I became the director of Indigenous Health and Advocacy from 2024 to 2025. And that was such a valuable experience because that's where I realized my purpose. That's who I am, a public speaker, a motivational speaker, an advocate, an inspiration for a generation. And so from that, I remember the president from the Canadian Federation of Nurses Union, she invited me to be part of their Indigenous Nursing Health Advisory Committee. So I was invited to Niagara Falls last June, 2025, and that was amazing because I helped them create this apology for reconciliation, and so that was amazing and beautiful to see firsthand. And I sat next to female leaders, and I'll never forget this one individual said, "Makayla, you are our future," and that made me so emotional because not once did I realize it's not just amazing that I'm Indigenous in nursing, but the fact that I'm like a female and Indigenous and in nursing, because I realized that women do experience discrimination in the past, especially for Indigenous communities. And so I realized that it's so amazing to do what I'm doing now. And I also got to go to Finland in same time, June 2025, because I gave a speech for the Faculty of Nursing last April, and I went for the International Council of Nurses conference, and they invited me because I shared the work I'm doing. I have also a letter of support from Wab Kinew, the Premier of Manitoba, where he just wished me well with my education. And I've been able to speak, for example, the president for the United Black People of Canada, because I realized my story can be related to different minority groups. And yeah, I'm just so grateful. I was on CBC News July 14, 2025, where I shared my story. And for a second time, this April 21st, again, second time on CBC Radio, sharing my journey in Vegreville and my plans for the future, and sharing that difficult discrimination experience I faced. But I can't believe it. I'm living a dream come true. And I guess a reminder that I'm doing my nursing education for the generations of Indigenous people that never had that opportunity to get an education, for all the generations and lives that have been lost at the hands of healthcare providers in Canada or the residential school system. And I know I need to keep going to inspire more people. So, yeah, Very
That is
grateful.
so, yeah, that is so inspiring. You had a really cool undergraduate journey. Um, and I'm looking forward to what you're gonna do next. Do you have any plans for what you want to do next?
Oh,
Not to put you on the spot, but I think this is a question that a lot of people are gonna have.
oh yes. I think so after my graduation June 9 at 3 p.m., I'm going to be so happy to walk across that stage. Like I think a little fun thing is seals are my favorite animal, so I just want to go
Oh,
to Vancouver and see some seals. But my plan is I'm glad to be done my education, not just for that dream, but now I can focus on going to all like the schools, the high schools, universities, colleges, to all the cities, all the Indigenous communities, and I will go back home to the Northwest Territories to remember where I came from and but to speak to the Indigenous youth because my story needs to be shared with more Indigenous people to bring them into nursing at the University of Alberta and just in healthcare. And so, yeah, I'm so grateful for that. And just a quick note too, when I grew up back home, like I was surrounded by poverty. I was surrounded by Indigenous people not leaving that community and not getting a higher education. So for my whole life, I felt very ashamed to be Indigenous. I didn't think I was smart because of Indigenous, and it took a lifetime to get here. And so I just imagine that there's an Indigenous person stuck in that community. They're stuck in an environment where no one will tell them, I believe in you, you're smart, you can do this. And I have to be that voice and bring myself to that community and find that next Indigenous person who wants to enter the nursing profession.
a few other things that we actually were just talking, and a few other things came to mind
I guess,
from both sides.
for example, like when I, I liked how you were trying to say that you're not trying to re-traumatize like me and kind of sharing my hardships and lived experience. And I want to say like I think you're doing the right thing. The fact that you're wanting to say, "Oh, Makayla, like I'm not. I don't want to re-traumatize you." Like you're trying to apologize and you're trying to do things the right way. The fact that you're asking me, that's really valuable. It's going to make any Indigenous person feel seen, heard, and included, right? So I think don't be like ashamed or embarrassed. Like you're doing the right thing, you're being cautious, and you're being considerate, right? And that's what any Indigenous person ever wants. And so for me, when I think about like that, where I almost lost my life in the hospital, and I'm so grateful I went through that. I'm so grateful that I had that negative experience because I survived. I woke up. And when I think about what I went through in the hospital that year, and it was a horrible experience, but I survived. I woke up. I have a purpose for my life. And I thought if I could go through that difficult time in my life, I can get my degree from the University of Alberta. I can go through anything. And I'm never embarrassed or ashamed about what I went through. And I can survive. I can accomplish new goals. And I will never be afraid about the future or any discrimination in healthcare.
Yeah. And truly, your mindset is very commendable. Like as I said, I've never met someone as resilient as you are. The ability, like your ability to um, shift the negative narrative into a more positive one in order to empower other youth is truly um, is like exceptional. It's I don't know how you do it, and not to say that like you left the negative narratives out because we talked about some of these things, but yeah, your ability to adapt and shift the narrative a little bit into yes, these are all the bad things, but this is not where we end. It's like you said, if we can't take back our lands, we can take back ourselves. Like this is where the hope is. Like this is like stay hopeful, have a purpose. Um, it's truly like I've genuinely never met someone as resilient as you are.
Thank you. And I think, yeah, I think what I learned too is like the biggest thing that anyone would need is like protect, like not just who you surround yourself with, like those individuals, but your mindset, like your mental health is the most important thing, especially for Indigenous people, right? It's like how to heal an Indigenous person from within. It's looking at their mental health. So for me, back when I upgraded at NATE in like 2019, my mindset, always kept a positive mindset, and that's where I started, right? So if you can't make change in like your education, your career, starting with your mindset and how you believe in yourself, that's like the biggest change that you can make. And I think too, like if I'll take a few minutes to share like some difficult things I went through. So as a child, I was sexually assaulted. I think it was kindergarten by my gym teacher, and it was a very traumatic experience. But I don't remember it, maybe because of how traumatic it was. But I remember my mom and dad crying. And in 2018, I was sexually assaulted as an adult. 2019, I went through the ectopic pregnancy where I almost lost my life, where, yeah, I felt like I was dying. And when I think about those times or being in that hospital, like I survived everything I went through to get my nursing education. And I also want to briefly mention it, another difficult time in my family of 7. So this was many years ago, probably after high school. I graduated high school in 2012. So me and my family of 7, we lived in a 2-bedroom apartment, and there was water damage nearby. So we had to move out. We tried to live in some hotels, but that got very expensive. And so we went through a very difficult time. So my dad was out of town at work, and we had an SUV. So we would put the seats back, put blankets and pillows. My mom would drive around the city late at night until all the kids fell asleep, and I would sit up and wait till all my 4 siblings were sleeping, and then I would sleep. So we lived like that because we had to. It was such a difficult time, and we would go to the rec center. Like we'd buy a swimming pass for a few months to make sure we showered every day, and the kids would have good memories swimming. But we went through that, and when I think about all those difficult times, I'm so grateful. I'm so grateful I went through that. Me and my family went through poverty, housing insecurity, and financial barriers, and that with also my own personal trauma. I'm so glad I went through that. I'm glad I got sexually assaulted as a child, as an adult. I'm so glad I almost lost my life at the Royal Alex Hospital in Edmonton because I survived. I survived everything I ever went through. And more importantly, that's my purpose for my life, to share my journey, my story. And I'm more than just a nursing student. I'm more than just a motivational speaker. I'm a leader to help fix the health for Indigenous Canadians within Canada. And I want to say I'm just so grateful for everything I survived, because I know it's going to help you. It's going to help someone listening. And that's my purpose for my life. My gift really is speaking. So I look forward to sharing more of my journey, and I'll never be embarrassed or ashamed. As long as it helps someone else, all the days of my life, I'll be happy. That's how I view my life, where if I could help just one more person, that's all that matters to me.
Yeah. Obviously the things you went through were very hard, and I wouldn't wish that on anyone. That's not okay. And I'm very happy you survived. I'm very happy you're here, and I'm very, very proud of you. And I'm sure you've heard that a lot recently.
Yeah, thank you. And I think, yeah, I have my best friend who I was talking with them, and I said, people see me as successful now with the CBC and the traveling, speaking at different conferences and events. And when I think about it, people see me as very successful now. And I think I find it funny in a way, because all I'm doing is sharing all the lived experience I went through being being an Indigenous patient, student. And I realized that my family, we are, like, what we experience is a result from colonization of the residential school system. And when I think about everything that I ever went through, and there's more than I'm describing in this podcast, there's a life of chronic mental health issues or stress, and I wouldn't wish this life upon anyone. I really wouldn't. And I would not want to relive it myself, but I'm grateful that I survived the hardest years of my life, and now I'm getting my education. I'm ending the cycle of poverty. I'm ending the cycle of intergenerational trauma. So again, thank you so much for having me, and for always wanting to look at ways how to treat Indigenous people with care. So I think, right, as long as we're trying, that's the best we could do, and continue on that journey to reconciliation. Yeah, and I just want to say thank you for having me here today. I want to say thank you in my Dene Doggerb language. I want to say Masicho, and I'm from Treaty 11 from Betchiko in the Northwest Territories.
Thank you so much for being here as well. It is truly a pleasure and an honor that we got to chat today. And thank you all for watching as well. Um, yeah, stay tuned to our next episode.